An 8 years old boy present with symptoms of right knee pain. The pain has been present most occasion for the past 3 months, and the pain typically lasts for several hours at a time. On examination, he walks with an antalgic gait and has apparent right leg shortening. What is the most likely diagnosis? Here are the options. Options are Perthes disease, osteosarcoma of the femur, osteoarthritis of the hip, transient synovitis of the hip, torn medial meniscus. So what may be the option? A 88 years old boy present with symptoms of the right knee. So first of all, let's see this is the avascular necrosis. The avascular necrosis of the bone in case of children, it is known as the Perthes disease. What occurs here? Here the femoral head are get avascular necrosis and death of the cell, and finally there is shortening. Now see the Perthes disease. Perthes disease is an idiopathic avascular necrosis of the femoral epiphysis of the femoral head, and it occurs due to blood supply of the femoral head, and blood supply of the femoral head occurs due to idiopathic cause. That means the underlying cause is unknown, and it causes the bone infarction. So it causes the bone infarction. New blood vessel may develop, and ossification also occurs, and finally it gain back. The bone either heals or there is subchondral fracture develop. There are many causes of irritable hip in the 10 to 14 years of the age. Many of these may cause both hip pain or knee pain. But here the important point to note that the Perthes disease, actually the age group is very important. That means from up to the 12 year of the age there is chance of development of the Perthes disease, and more than 12 year of the age actually there is development of the SUFI, that means slipped upper femoral epiphysis. So more than 12 years of the age usually SUFI develop, and less than 12 year old there is Perthes disease develop. And in case of very young, that means 1 to 2 years of the age, in this age group there is the DDAs, that means development dysplasia of the hip joint. So this age group is very important regarding the answering the question, that above the 12 year of the age usually SUFI develop, below the 12 year and above the 3 to 4 year this is the Perthes disease develop, and 1 to 2 year it is DDAs developed. Other options here such as the transient synovitis. It is a commonest disorder but does not typically last for 3 months. So transient synovitis, it usually resolves spontaneously within 3 months, but in this patient there is more than that. And osteosarcoma is a clinical condition, and in this condition limb shortening usually not occur. Another option, which is the SUFI, the slipped upper femoral epiphysis, it causes similar presentation although typically present later, that means after 12 years of the age, and with different patient characteristics. So what is our option? 8 years old, and as it is below the 12 years, so direct go for Perthes. The other option also present, you can match with them, but the age group is very important regarding the MRCS question, because the MRCS more focus on the age group regarding the children age and their different type of the disease.